Hello, I'm Dr. Frances Pitsillis. These days, many people take medications. Some of the commonest things that people take medications for are their blood pressure, too much gastric acid or acid reflux, and for heart conditions, beta blockers, and for cholesterol. So you would wonder, is there any problem with them when it comes to your nutrients in your body? Well, there is. Many drugs can cause nutrient depletion and therefore can sometimes help to make your condition worse, ironically, if you think about it, or at least cause new problems. So, how does this happen? Because sometimes the drug stops you being able to absorb the nutrient in your food. Sometimes it reduces the production of that nutrient or the transport of that nutrient into the cell. And sometimes it interferes with the metabolism, the breakdown into the active form of that nutrient. And sometimes it can even interfere with you getting rid of that nutrient out of your body. Now, according to the Centers of Disease Control and Prevention in the USA, the number of adults taking medications or at least one pharmaceutical drug in the previous month, aged 55 to 64, rose from 62% in the 1988 to 1994 period to 73% in the 1999 to 2002 period. This suggests that the potential for drug-induced nutrient depletion is growing. So let's have a look at some of the things that people can have problems with. So if we look at the anti-ulcer drugs like omeprazole, which is one of the proton pump inhibitors, that depletes calcium, vitamin D, B12, magnesium, protein and beta-carotene. And we know that that could influence dementia production, and because it depletes magnesium, it may affect heart disease and it may increase the risk of bone fractures. So that's an important thing to know about. And you can look at ways that you can avoid taking proton pump inhibitors, including keyhole surgery very often, which then allows you to come off your medication. Now, many of the diuretic blood pressure medicines, and they're used for the heart as well, will reduce magnesium. And ironically, you need magnesium to lower your blood pressure. Isn't that interesting? And B vitamins and coenzyme Q10, which gives your cells energy. Some of them reduce B6, folic acid and other things. Calcium channel blockers that are used for blood pressure and controlling abnormal heart rhythms can reduce vitamin D. And vitamin D is important for over 1,000 genes acting in your body. And then we look at the anti-diabetic drugs. Now we know that diabetes causes a reduction in many things anyway, like zinc, magnesium, vitamin C, chromium, probably selenium. And so many of the diabetes drugs will lower, some of them, vitamin B12 and coenzyme Q10. And coenzyme Q10 helps diabetes and helps lower blood pressure. And then antibiotics, hopefully you're not on them for too long, but some of the antibiotics can reduce an array of different B vitamins and antioxidant vitamins. Now, another important group are the antidepressants. SSRI antidepressants like Prozac reduce melatonin, and you need melatonin for sleep. Tricyclic antidepressants reduce coenzyme Q10 and vitamin B12. Vitamin B12 has a role in mental health. What about the contraceptive pill? An array of B vitamins, magnesium and zinc. Folic acid, selenium. So if you're on the contraceptive pill, there are many supplements out there that are formulated for you to take while on the contraceptive pill. And what about statin drugs? Well, they interfere with cholesterol production, so that means that they will reduce your hormones and your vitamin D, and they have other effects as well. So if you're given some medications and you know that you have a complicated history, health history, and you know that you're taking many of these medications and you're worried about the ongoing effects of what they might do, it probably doesn't hurt you to have a good general multivitamin. If you've got diabetes, heart disease, or blood pressure, consider coenzyme Q10. Fish oil, maybe some vitamin C, maybe some magnesium. All of these help many chronic conditions anyway. And if you're still not sure what to do, see someone who knows their nutrition, a doctor or a nutritionist or another health professional that knows their nutrition and knows how to help you.